Welcome, everybody, to this and an ongoing series of webinars from the Consortium of Universities for Global Health. I'm Keith Martin, the Executive Director of the Consortium, and we have a fantastic webinar today with a wonderful moderator and three stellar speakers. This webinar is on Global Fund, governance, and public health. And the genesis of this came out of a series of special articles in the Annals of Global Health. And what we're going to do together with our speakers is explore the intersection of governance and health outcomes, because we know that public health outcomes are critically determined by the strength of public institutions and governance. Where governance is weak, where public institutions are weak, health suffers, healthcare outcomes suffer, and countries can become increasingly fragile. So today I'm going to hand this over right now to our moderator, Dr. Phil Landrigan, who's the Director of Public Health at Boston College, and he's also the editor of the Annals of Global Health, and you can see how to sign up for the Open Access Annals of Global Health on in the slide. So Dr. Landrigan, thanks for being our moderator. I'm turning it over to you to start the whole process. Thank you.
Keith, thank you so much. Welcome everybody to the webinar. This is the first webinar that the Consortium of Universities for Global Health has done in partnership with the Annals of Global Health, but we hope that there'll be a couple of more over the coming year. As Keith said, today's webinar explores the intersection between the Global Fund, governance, and public health. We have three speakers. We have Ambassador Dr. Eric Goosby, who's now at UCSF. We have Matt Cavanaugh, who is at the O'Neill Center at Georgetown University. And we have Meg Davis calling in from Geneva, all of whom have extensive experience with these issues. The catalyst for this particular seminar was the publication just a couple of weeks ago in the Annals of Global Health of a special collection of articles, a lead article by Matt Cavanaugh and his associate Lishui Chen at Georgetown, and an essay by Ambassador Goosby. So I think this is a very timely issue. There's a lot of skepticism today, people saying that foreign aid is of no value, that it actually undermines institutions in the countries that are recipients of the aid. That skepticism is often offered without any supporting evidence, but as we all know, evidence is important, facts matter, and the seminar today, the webinar today, is intended to explore the factual basis, the pros and cons of health aid. What does it do? What does it fail to do? So without further ado, let me hand it over now to Ambassador Goosby. Eric, over to you.
I was just going to say that the importance of this discussion now in understanding after 17 years the contribution that the Global Fund and its governance requirements have introduced into planning and implementing efforts that converge domestic, bilateral, and donor resources together to create the medical delivery system in the country. It is one of the first times we have been able to actually create a conduit through which a shared responsibility could be realized by all of the donor contributors and domestic resources. So it's really a remarkable moment. Thanks.
Yes, thanks everyone. So thanks all for joining, and we're really very excited to be able to do this with CUGH and with the Annals of Global Health. So Lishui Chen and I looked at this core question when it comes to the governance effects of the Global Fund, and we all have, many of us worked with the Global Fund for many years, and in so doing, we of course know that there is, a widely lauded effort underway to end the AIDS, TB, and malaria crisis. The much publicized work of the Global Fund in addressing each of the diseases has been incredibly effective. It's widely been applauded as one of the most effective entities when it comes to aid structures in the world. But what we know is that providing health services is only part of what we need for long-term success against these major killers. And that in fact, that success is in building effective health systems when it comes to countries that have done well. They rely on strong systems of governance. And so by that, we mean institutions of power, right? And politics that ensure a couple of key things, that ensure wide participation, transparency, robust accountability, effective capacity to regulate, checks on corruption, strong legal system, et cetera. And that those governments that are able to ensure that level of engagement, have you lost the slides? Can you see me again now? Great. So those governments that have been able to do so have found that they are able to coordinate effective policy to improve well-being, and that is, of course, the entire goal of the effort. And so there is this tension, right? And this comes in part out of a long-standing debate that's been around for a while, a rather infamous debate that's involved in part Jeff Sachs versus Bill Easterly and Dambisa Moyo and others, that kind of within the political economy world breaks down into kind of two rough camps, right? The aid optimists who say, look, ensuring sufficient resources in a country can, under the right circumstances, achieve the goals of increasing economic growth, mitigating poverty, improving provision of public goods. The core issue of capital is itself a precondition. It's not a silver bullet, but without it, you can't actually address core development issues. The aid pessimists, on the other hand, have really argued the opposite. They've really challenged this link. They've said aid results in dependency, it undermines development, and governance has been a key part of this conversation. So, you know, when we talk about these kind of idea of good governance institutions, we've shown over and over again in the literature and in real life that, in fact, they are critical for economic and human development. That expanding access to services, if we do that, but we undermine the institutions of development, they could be a net negative, right? And so, you know, there's been a number of studies out there on aid overall, and they're really very divergent. You find some that say, you know, that there's a net negative effect of aid on governance. Others have found an overall benefit. When they've looked at corruption specifically at overall aid, some find a positive result, some find a negative result. But not all aid is the same, and health aid, I would argue, and it's been argued by multiple people, is in fact distinct from overall ODA. Nonetheless, this concern about whether funding public goods through aid rather than from, for example, citizens and taxation, that if that can undermine political accountability, democracy, economic regulation, et cetera, that if that's what's going to happen, then we might actually be trading the good for, you know, good work on one front and bad on the other. Anyone who works in global health has seen this, of course, right? That donors, when they drive the agenda, when they cut out communities, it's really hard to hold decision makers accountable. When decisions are made in Washington or in Paris or in Geneva, even very active citizens in Malawi or Thailand or Ukraine really struggle to hold decision makers accountable. So if that's what the question is, we need to understand that, of course, we would rather that strong governments with sufficient resources that are open and democratic are able to provide public goods. That's the ideal. But the question before us is not what to do in the ideal, but instead, what do we do in the absence of that ideal, right? Is there a way to tend to the deficiencies of aid? Now, many of us had perhaps thought that we had moved beyond this, right? And for a short period of time, it really seemed like we were kind of moving away from questions about does aid work or does it not, instead into questions about what makes aid work and what kinds of aid have differential types of effect. But in an era of populism, it's come back, and I think it's come back quite hard. So we hear National Security Advisor John Bolton recently unveiling the Trump administration's new Africa strategy, arguing that, quote, long-standing patterns of aid without effect, assistance without accountability are a problem, and announcing a shifted path that would focus on securing stable and transparent governance on the continent rather than doling out so much aid. Penny Mordaunt in the UK, the International Development Secretary until May, launched her new conservative strategy that she said we're going to, quote, help countries stand on their own feet and build sustainable health and education systems by tackling, quote, man-made crises like corruption. So the question is, are these things in tension? Do we have to choose between better health and better governance? Global health aid in this case is an exception, but the core questions have to be explored. So what we set out to do was to actually explore these in further depth. So for those less familiar with the Global Fund, it was created in 2002 at the height of the AIDS pandemic as a novel institution, a global health financing mechanism that was able to pool contributions from nations, foundations, the private sector, et cetera, and distribute them both to public and non-public sector, or public and private sector actors, non-governmental actors as implementing agencies. And it's just worth noting, and this here is a picture of how the grant-making process within the Global Fund works that's included in our paper. And as you can see, it's a complex process, and that governance was particularly a concern from the start. So all financing is required to be based on a plan developed by the country. That plan is then sorted through a country coordinating mechanism at the country level that prepares those proposals to the fund. And it also oversees the implementation. So with representation required from government, non-governmental organizations, civil society, multilateral and bilateral agencies, and the private sector, the fact that all of those are included in the country coordinating mechanism that has to sign off on the writing of a grant, this is a very unique structure when it comes to aid. It then goes through a number of different processes. Each grant has a principal recipient organization that receives the funds and is responsible. Those PRs are government agencies, some are international organizations, but they're responsible to the CCM. An independent professional local fund agent is contracted in each country, and they provide oversight and verification both of the financial and the programmatic process. And at the global level, each application is reviewed by an independent technical review panel. So these kinds of unique structures were set up explicitly to address the governance challenges of aid. That working through local court systems, the Global Fund has recovered large portions of misallocated and misappropriated funds. The funds also invested significantly in human rights and programming intended to strengthen the rule of law. So there's a wide variety of things that were done because when the Global Fund was set up, of course, people were conscious of the limitations of aid. But does the net effect of these structures actually have the intended effect? And that was the core question that we asked. So in order to estimate the impact of the Global Fund financing on governance development, we put together a unique panel data set. We got funds information from the Global Fund Secretariat by country per year from 2003 to 2017, and then we tried to model the effect of those on financing. On your left here, you'll see some of the indicators that we included as outcomes, and they're the elements of the World Bank's World Governance Indicators project. And we use those because it reports data for over 200 countries across multiple different elements. And that includes the kind of multiple ideas that are within the idea of governance. It has multiple related and interrelated aspects, including control of corruption, which often is described as the interchangeably, but which is only one piece of really the idea of governance, right? And so this control of corruption, of course, is directly related to whether or not countries are able to secure the assets that they receive. But there's also the indicator of voice and accountability that captures the alignment with core democratic rights and political freedoms. The regulatory quality that it reflects the degree to which governments can properly implement policies. Government effectiveness is another element, and that's among the most nebulous, I should just say. It's trying to capture the range of concepts, including the quality of public infrastructure and whether civil servants are able to do their job without political pressure, et cetera. And then we also included a number of two measures here that tried to capture overall development and health. And so what we did is to put those elements into a model and try to understand the impact of the Global Fund financing on aid overall. We also included a number of different control variables to address these alternative explanations. So we know that richer countries generally score better, so we included a control for income level. We noted that there's a clear link between governance and war, violence, and political instability, so we controlled for that as well. We included an indicator here for time trends to ensure that over time we were catching the effects there. And we also tried to disentangle the effect of the Global Fund from other aid programs, including programs like the President's Emergency Plan for AIDS Relief, which is a bilateral. So we included an overall measure of aid. We also wanted to take account of reverse causality as a possible alternative explanation. That is that better governance drives increased aid from the Global Fund instead of the other way around. Do better governed countries get more aid? Now, this has been explored a fair amount, and there's a core set of questions, but two things are worthy of note. One is fund policy doesn't normally take account and doesn't formally take account of governance when allocated funds. So millions of dollars, hundreds of millions have actually been invested in Botswana with a really good control of corruption score, and in Chad, which falls in the 5th percentile. So clearly funds are distributed in that way, but we also included both overall aid measures and a control of corruption score at the baseline time in 2003, just so that we are actually trying to understand what's the effects over time of global fund funding. And so here's what we found. We find evidence that a significant beneficial effect of global fund financing is associated with increased, a beneficial effect seems to be shown associated between governance indicators and increased financing from the Global Fund. So this table is a summary. It shows a number of different models that we ran that I'll walk through quite quickly. But what you see here is that the blue and the dots here indicate a significant and a beneficial effect. Now, just note that a beneficial effect means a positive governance score or a positive HDI score, as well as lower adult mortality, right? So this is reflecting the idea of better. And what we find is that overall, the ones with the blue and the dots here are statistically significant and they're beneficial. Just to run very quickly through the ways we tried to model it, because we really wanted to test a few different understandings and theories in our work. So the first, we modeled the effect of total global fund financing while controlling for national income, stability and violence, and time trends. So that's model 1. We then built an added bilateral aid into it in model 2. Both models, as you can see, show a significant beneficial effect on most of the variables of interest except government effectiveness. We tested whether shifting to measuring global fund financing on a per capita basis matters instead of a simple per capita instead of a simple bivariate, and so we chose that as well. And then we also added, and finally adding back in the idea of a per capita with most of the controls added, and you can see the effect there. In the former, government effectiveness gains significant. In the latter, voice and accountability loses significance for only the time in the model. And then finally, the bottom one you can see is that what we considered our full model, where we added baseline corruption to the control, to the model as a control to test for the possibility of reverse causality ex ante. So overall, what we find, right, is that there is a significant association between increased global fund financing and better governance, including a number of different causal claims. Some have, of course, worried, right, that aid is, dead. That's the famous book, right? Aid is dead, and we would expect if that were the case, if aid were having a negative effect, we should we should see that in this model, right? You should see a negative effect on governance over time, especially over this period of time. It might, on the other hand, have been the case that when we looked, we saw no association, right? And if there were no association, we could maybe just take the global fund financing by itself and say, what should we do? There's no effect on governance, and therefore we're free to just fund AIDS, TB, malaria programs without worry. But what we instead find is that actually there is a significant association. And so it doesn't support the critique of dead aid. Instead, it's consistent with the proposition that the global fund architecture is supporting the ambitions to address the urgent and continuing crisis of AIDS, TB, and malaria while being associated with improved institutions like fighting corruption and supporting development. So happy to take questions and talk more both about the methodology and what we found. Thanks to all for your attention.
Okay, so we'll now hear from Meg. Yep.
Great, thanks very much. And thank you, Matt, and your colleagues for this really important and interesting work, which I think raises great questions that we could dig into for much more than the allotted time. And I think one of the things your work shows is how, as we begin to think more broadly about universal health coverage and this campaign towards expanding healthcare for all globally, how HIV, TB, and malaria and the response to those three crises have really been at the vanguard of thinking through some of the challenges of global health governance. So I want to raise some questions, if I can advance my slide. Yes, okay. About the Human Development Index as a tool, and some of the challenges and also some good practices that have emerged in the Global Fund's work with countries. So the Human Development Index, as I'm sure many listeners are aware, is really one of the most popular indices in the moment when indices and data and indicators are really on the rise in global governance of all kinds, not just health, but also climate, labor, lots of other areas. And here I'm drawing a lot on work by Sally Engel-Mary and other anthropologists and human rights scholars who've thought about the politics of indicators and some of their system effects in contexts where they're used. So indicators are, when we use indices like the Human Development Index, they're really framed by implicit theories about what is important to measure and what is not important to measure. They acquire the appearance of objectivity and truth and neutrality. They can sometimes make their interpretive work invisible, so it can be difficult to trace back what it is about human behavior that we've abstracted and converted into data and then into an indicator that we can measure. And then, of course, there's this ranking. So we always wind up with rankings of countries. Inevitably, the Nordic countries wind up at the top. And improvement in one entity always seems to mean a decline in another one. So the Human Development Index became popular and widely used because it addressed certain things about governance that were important, that countered the tendency to over-rely on national income as an indicator. And it's also great because it's simple and it's clear, and UN Development Program has backed it and used it a lot. So there's a lot of data, which is always nice, but it sometimes can hide some of the challenges with commensurability, how comparable one country is with another. It can sometimes mask areas where we're missing really critical pieces of data, and it also masks the way that people who are producing the data shape the way the data is abstracted and reported. So for example, we sometimes wind up with cases where, for instance, here's Switzerland, the country where I'm very fortunate to live. It's a wonderful country, #2 on this list of HDI rankings. Switzerland, just 2 weeks ago, there were massive protests across the country by women demanding better gender equality. And gender inequality is not one of the things that is measured in the HDI. And that's one of the areas where, we really want to be able to think about what the global fund's effect or not absence of effect might be in a given country. So what are the kinds of things we would want to measure when we're thinking about governance and global HIV response? And I would argue some of those things are not captured by the HDI. So good governance for the majority of the population may not be good governance from the perspective of those who are most at risk of HIV. And that includes gay men and other men who have sex with men, sex workers, people who use drugs, transgender people, prisoners, migrants, others who are often most ostracized in society. Indices that are produced by key populations, those populations themselves, show that many of the countries where Global Fund invests criminalize same-sex sexuality, they criminalize sex work, drug possession and drug use is subject to very extreme prison sentences, generally do not recognize legal gender change. There's in many countries closing civic space, which limits the ability of key populations to form NGOs and to register organizations and open bank accounts. And then there's widespread stigma and discrimination in many countries in the health sector. So something called the People Living with HIV Stigma Index, which has been conducted in many countries, has documented widespread health sector discrimination against people living with HIV. And sometimes the results of this impedes our ability to actually develop programs that reach those populations. So here I'm showing a shot from the UNAIDS Key Populations Atlas. Actually, this is a slightly dated version, but the data hasn't gotten much better. This is showing the lack of data on men who have sex with men in many countries. And so it's very difficult to know how to reach those populations who are most vulnerable to HIV when they're often hidden due to criminalization, stigma, and discrimination. There's no data, there's no information about what's working, we don't know how high HIV prevalence is, and so this is a huge challenge in the Global Fund's response. So good governance from the perspective of the majority may not be good governance for women, for key populations, and for girls. And I would argue, and other human rights scholars have argued, this is kind of how we got to having a global HIV pandemic in the first place, is this kind of inequality and stigmatization. So having framed that, I just want to raise one good practice and two challenges that the Global Fund faces. So this is a picture snapshot I took illicitly from the back of the Global Fund's boardroom. The Global Fund is unique in having a very inclusive governance mechanism and in having very strong commitments on human rights and gender equality. So the slogan that has been adopted by key populations groups, "Nothing about us without us," is very much frequently used at the Global Fund. And this is really important because it means that civil society organizations that represent those populations and that speak for people living with HIV and for domestic organizations in implementing countries have a vote on the board, and they have a lot of power on the board of the Global Fund. And that's part of why the Global Fund strategy includes clear commitments on human rights and gender, something that many development aid agencies have been reluctant to adopt. And Global Fund also has an initiative that aims to fund human rights programming in 15 to 20 countries, and a very promising initiative to scale up funding of programs to reach women and girls in high-burden countries, showing some promising results. And that's there in part because activists who are on the board of the Global Fund, Matt has done his bit there as well, have really played their role in advocating for those commitments. During the time that I worked at the Global Fund on human rights, we established minimum standards on human rights in grant agreements that the Global Fund signs in 140 countries and a hotline for human rights complaints. Not always clear how well this has been followed up, so that's another question, how you ensure compliance with those standards. But nonetheless, it's a very ambitious set of commitments. And that in turn raises two challenges that I'm just gonna touch on. The first challenge is the limited bucket of funding, this manufactured scarcity that we're coping with globally, in the US with PEPFAR and globally with the Global Fund, which is now facing its sixth replenishment, pressure by donors to limit the funding, to transition out of middle-income countries, and to focus their investments just on low-income, high-burden countries, especially sub-Saharan Africa. And in those countries where the Global Fund is transitioning out, it's a real concern for people living with HIV, for key populations, and for women and girls, because a lot of those unpopular programs are really funded by the Global Fund or funded by external aid. And so when those external donors depart, it leaves those key populations and human rights programs really in the lurch, because it's unlikely that a government is going to always take on the funding responsibility. So there's a real risk that we lose some of the ground we've gained on governance in those countries, and the country coordinating mechanisms that Matt highlighted in his paper are also going to start coming to a close in countries where the Global Fund leaves. So the fund is advocating with governments, trying to persuade them to continue the good work that's been done that Matt's paper documents, but it's very difficult to make the case for a government to do something it never really wanted to do when the donor begins to exit. So that's one challenge. And then the second challenge has to do with this global push to shift towards universal health coverage and to end what's called HIV exceptionalism. We could contest that term a little bit, but anyway, to stop the focus on ending AIDS and to instead try to integrate all HIV programming into universal health coverage. And for the HIV sector, we have this great governance standard of the greater involvement of people with AIDS, the representation on the Global Fund board, which I mentioned earlier, nothing about us without us. And there is a risk of potentially losing that as we start to move towards integrating and merging global health institutions as part of a global action plan for healthy lives and well-being, which is now underway. So civil society that represents key populations, women, people living with HIV on the boards of global health governance are now facing this risk that they may lose that ground that was so hard won and that has helped promote good governance in countries. So some difficult questions and some challenges, and look forward to discussing that further with the group and with the audience. And thanks very much. Back to you, Phil.
Thank you, Meg. Thank you for that lovely summary of the key issues, and also for having highlighted the gaps. So we're now going to open this up for questions. We've got about 25 minutes left, so we've got some good time for questions. We've got several good ones in. Let me start, and before I start, let me say to everybody in the audience that if you wish to send a question in, please use the chat box on your screen and type it in. Say who you are if you wish, and we'll try to. And if you want to indicate to which of the speakers the question should be directed, that's helpful. And we'll do our best to get through as many as we can in the allotted time. So one of the first questions, I'll read it, is how can we build capacity in fragile countries to strengthen justice systems? And I'll put that out to any of the speakers, whoever feels comfortable to answer that one.
This is Eric. I think that's a strategic and timely question to this discussion. How do you impact a improvement in the governance of a programmatic effort when there's a political cultural disagreement with how to address, identify, enter, and retain different populations in care and treatment services? The example that has occurred in many countries is laws around homosexuality, the act of or participation in groups that are associated with promoting homosexuality. In Tanzania, in Uganda, took a legislative route, and our ability to engage country leadership in discussions around that very much came off of the platform and familiarity of stakeholders that had already occurred through the CCM process, and allowed for a forum and a target for that dialogue to be delivered. It also was something that was understood by the political leadership, especially in Uganda, as something that they had already invested in over the years in supporting, and there was a trust level in that dialogue as different donors made their feelings known to political leadership in Uganda, and the forward movement or not of a legislation that was constraining and had concerns from the donor perspective. That dialogue would not have occurred had that convening not already presented a platform.
Thank you, Eric. That's a great answer. Now, the next question is actually quite parallel to that, and the question reads as follows: how, in fragile countries, how can we build capacity to strengthen justice systems? Actually, I think you've already answered that. Let's. I don't think there's much more to be said about that. Let's move on to the next one. Now that you've identified these significant challenges, what do you suggest is the way forward, especially for fragile countries?
Yeah, you know, I think that really is the critical question. How can a relationship that multilateral donors and bilateral donors have with country efforts to respond to diseases from day one strengthen the country's intrinsic ability to manage, oversee, monitor, and evaluate these programs? I think the tendency and the flat-out threat that donor resources have every time they come into a country is that the country does not take ownership of the standard of care that is being impacted by the infusion of resources or capacity, and the not actively, as a country host, decide that the change in the standard of care that this resource introduces into your delivery system is or is not something that you are going to embrace as the country's standard of care. Everybody with this disease has the following things that should happen to them and services that are available to them. And without that acknowledged incorporation of a new standard of care, when donor resources recede, that continuation, the resilience, and the stability of the intervention already expanded by the donor infusion may or may not be continued. And I think at the front end, and I believe the governance process through the CCM affords an opportunity to have that conversation, expand the continuum of services for that given disease, changing the standard of care, and therefore identifying what needs to be continued when the government's resources are not supplemented by donor monies.
I totally agree with what's just been said, and I also think that when you're engaging in trying to change a country's governance system as an external donor, it has to be done in ways that are very sensitive and aware of the historical kind of colonial power relationships and not treading too heavily. So I think the challenge is for donors to make clear what their bottom line is and what their values are, but then to really try to convene diverse stakeholders within the country so that they can have the conversation that they need to have, which is often one that hasn't been happening. So making sure that strong civil society and human rights advocates are at the table and key populations advocates alongside their government counterparts, I think has been proven, and I think the Global Fund has been one of the agencies that's proven it to really work in helping to move things forward. But donor conditionality, I think, can really backfire both for the donor and for community-based advocates within the country who then are left exposed as having cost the country money because the donor was unhappy.
What we found here in this piece was we looked specifically at the Global Fund. And what we see overall is that aid really has kind of a mixed track record about whether or not it's actually associated with better governance. Across a number of measures that really mattered, we found that it was. But remember what the Global Fund is, right? It's a really unique organization. And so the question of, is there danger to trying to combine all global health programs into one? I would say there very much is, because what was created under the Global Fund was a set of mechanisms designed explicitly to address two things. On the one hand, we want funding to flow to countries. We need as much funding as we can get to the ground to address these three epidemics. But in so doing, where we're doing that in ways that are not about accountable, democratic, open ways to move money around that don't come from communities, we have to build in as many mechanisms as possible to address the deficits that creates. And as Meg is mentioning, right, core ones of those are who has a seat at the table, what information do they get, how are decisions made, how transparent are they, et cetera. The Global Fund has instituted a number of really quite important decisions when it comes to the institutions of governance. These are really unique in the global health architecture. And so as I hear conversations about we should just wrap it up or we should roll things into other settings, I really worry that I have not seen most of the other global health structures take on this level of different institutionalization of governance issues, and have not learned all of the lessons, both good and bad, right, that have come out of the Global Fund processes. I don't want to imply that somehow this is perfect. There are very significant deficits that remain, but compared to many sources of global health funding, it's remarkable. So really learning those lessons now before we talk about integration, or at least collapsing into, is really critical.
This is Eric. If I could just amplify Matt's point. I think that it becomes critical that we remember the reason the Global Fund was invoked was because the response that was present in countries most heavily burdened by the three diseases was underperforming in their response. And that was the impetus to say, what is the responsibility of the global community in strengthening the response to those countries that are disproportionately burdened with a disease? Is there a responsibility? How does that responsibility flow? Once you engage and start putting resources in, your responsibility is altered in a way that should speak to some discussion around sustainability of that funding. Has the responsibility changed over time? Now, I thought I was really in a shared responsibility relationship initially, but now 17 years down the road, I don't think I'm still in that relationship. There needs to be a discussion, preferably, ideally convened by the country to incorporate and align what they want to continue and support with domestic dollars as their standard of care for this disease moving forward. A donor is not in a position to have that stakeholder convening discussion and is crippled when they try to do it. The country is in the best spot, and I believe in the appropriate spot, is the appropriate entity to convene that discussion.
Thank you, Eric, and thank you, Matt. So We now have several questions that pertain to sustainability, which I think follows nicely from the conversation we've been having. I'll read one, which is representative of a half dozen similar questions. It says, can donor agencies put into place a supportive sustainability plan to keep programs alive and healthy after the donors have departed? So I'll open that up to any one of the three of you.
Oh, I'll dive in because fools rush in where angels fear to tread. And I think that, this is certainly the task that the Global Fund has taken on, and that I think other donors are now beginning to realize that they also need to take on, because abrupt transitions, just withdrawing on, the spin of a dime, can be really damaging and can really lead to a lot of loss of the ground that's been gained in the fight against HIV, in particular, because of the stigma, discrimination, and criminalization. But I think the challenge that all of us have to recognize is that there is no scenario in which most middle-income countries are going to start funding programs for the most stigmatized and ostracized communities within their borders. And so I think, for instance, if you want to fund work to decriminalize drug use, which has been shown to have a massive impact on adherence and access to treatment for people who use drugs, that means continuing to fund drug user groups to do that advocacy. And similarly for all the other issues facing key populations. And so there's not going to be a scenario necessarily in which Russia is always going to be ready to step up and start funding advocacy by drug users for harm reduction services. So I think part of a sustainability plan has to include thinking about ensuring that key populations programs are continued when the donor leaves, and that you're not just abandoning people to their fate.
I would also say, just building on that just briefly, I think that I entirely agree. And then the other thing that I would just add is that, to Eric's point about what does it look like to succeed, to me, sustainability means you've reached a level of new HIV infections, of death from TB, from death from mortality, right? That we actually have control of these epidemics that governments are able to take forward. To Eric's point, these were created as institutions because countries alone are not able to coordinate this level of sustained action. And so to decide that we're going to move into a sustainability mode when we haven't actually reached that level within the epidemic is really rather cynical. But the other thing that I would just point out is the other kind of piece that's really often missing, that I hope we see a lot more of in the coming years, is conversations with the IMF and Global Fund and other entities that I said have a lot of power over the tax collection and the revenue raising, as well as the revenue frameworks that most of these countries are operating in. One of the things that we found from the Global Fund, right, was that these aid dollars are associated with better governance. That means open and transparent. That means really being engaged. The countries that are especially engaged with the multilateral institutions often don't have the space within that conversation to actually take on a number of the costs that they might otherwise be able to. So until we get to that whole holistic view of sustainability that includes both the EPI and the fiscal space, we're probably not going to make a lot of progress.
Thank you, Matt. So the next question is from a somewhat different direction, and it reads as follows: what actionable steps by the U.S. Congress would be most prudent right now for supporting the Global Fund? Anyone?
So there's a couple that are really important. First off, it's just, folks that follow it closely probably know that the Global Fund is going into a replenishment period. And so it's going to be convened by President Macron of France, and the United States is going to be a major factor there. Right now, the conversation is, what will the U.S. pledge look like to that replenishment process? And we're looking at that from a multiple year understanding where the United States has contributed 1/3 of the funding to the Global Fund, and that has been incredibly important for sustaining the fund's process overall. But it's also played a very important political act, right? That when the U.S. government said we will match $1 for every 2 that come in, that has meant some real pressure on some other countries to step up as well. I think many of us are quite worried about the president's budget, which came out that made a plan that would include an approximately $1 billion cut over the 3 years, is my understanding. Now, luckily, the appropriations process is such that the Congress is actually the one that decides what the budget will be, but it's not always the Congress that decides what the pledge will be. And so I think there's a real opportunity for some education of the world about how our political processes work, but also for Congress to step up and say, this is an institution that we have invested in and will continue to do so. If that's what happens, the biggest tragedy would be if we lost political momentum while the United States Congress continued to actually support the Global Fund in a big way. It was really reassuring to see a bipartisan bill passed that would increase the Global Fund. So now there's a political process to have the world understand that.
Hi, I totally agree with what Matt has said. And I would just add that another really important thing that US Congress could do, but I don't think they will do, is to end the Global Gag Rule, which prohibits organizations that receive US funding from discussing abortion, and has been really devastating for organizations, not just that work on HIV, but even organizations that work on other issues like tuberculosis are also not able to accept US funding if they have other programs funded by other donors in which they talk about abortion.
Thanks, Meg. Thank you, Matt. So following on that, what would, if you had to summarize 2 or 3 arguments that you would make to members of Congress and senators in support of the Global Fund, what would those arguments be?
Well, this is Eric. I think that the idea of reminding the congressional leadership, and there is a strong bipartisan group of appropriators that feel protective of the Global Fund. So I think in many ways we have the substrate to continue this support already in place. But the role to continue to remind appropriators that there is an ethical responsibility that countries that have resources have to those countries that don't have resources, and it reflects on some level Sarah's comment about post-colonial neo-colonialization thinking, very dominant in sub-Saharan Africa in particular, and political leadership in sub-Saharan Africa thinks in those terms when you understand that as a donor trying to expand and support partnerships instead of traditional donor-recipient relationships. But if there's a partnership agenda, the ability to move together in an agreed upon time-framed effort where the investments are buying specific agreed upon outcomes and monitored to confirm it, you really continue to evolve in what may have started as a donor-recipient, highly prescriptive, kind of paternalistic identification of priorities for these monies. As you move into planning processes that convene local stakeholders, and as you begin to nurture, develop, expand the constituency in country that speaks to leadership around the need to continue these services, you create something that is sustainable. And any other that is short of that falls short of a sustainable outcome. So I believe we know enough to start with those types of expectations, create partnerships that are focused specifically on expanding the capacity of the country and country stakeholders, including civil society, to manage, oversee, monitor, and evaluate these programs. And that should be the goal on day one.
Thanks, Eric. So we have time for one. We have time here for one more question, and the one I'd like to finish on is a question that asks, what are our thoughts on the potential effectiveness of the global financing facility? Any of you'd like to tackle that one?
So I won't comment in depth because I don't have a strong enough empirical base to do so. But let me just say the following. one of the things that we were interested in doing the paper that I just described, one of the things we wanted to see was there was a theory when the Global Fund was created that you could do global health aid a bit differently, right? That you could think about a different kind of relationship. The kind of annoying tangle of Global Fund processes that is often a real challenge for folks to navigate exists in part because there was a real recognition that aid was good at some things, but it had sometimes negative externalities. And that's just true, right? I mean, this reality that what we would like is for governments to have sufficient funding to be able to meet the needs of their populations is really critical. The idea that then it would also trickle out into civil society organizations and that there would be human rights protections, et cetera, in a kind of context is incredibly important. And aid can do all of those things, but it has these negative externalities if we're not careful. I'm worried that we've lost the sense that that's a priority. And so I do think that the GFF could really focus on a bit more strongly the engagement, not just at the global level, because they've done some really good work thinking about kind of how do you bring in at least some civil society into the GFF, but really at the local level in a really substantive way. The Global Fund has had some really interesting experience with what works and what doesn't in country coordinating mechanisms, what works when you're bringing everybody around the table. But this core idea that civil society, community is affected, the private sector, the public sector, government from multiple different angles need to sit together to address the health issues so that we understand not just the medical needs, but the social drivers of disease and mortality. That core idea, I think, remains. And I think what we found in this piece is that doing so has positive effects. So I would love to see entities going beyond the Global Fund, figuring out the lessons that they've learned. And so far, I haven't seen the GFF do the same kind of deep work to actually address the governance issues. Now, we haven't analyzed the Global Fund, the GFF, and it hasn't been around as long, and it's a very different model. But my sense is that we're not going to see the same kind of not just addressing the negative externalities, but actually, improving governance unless some of those mechanisms are adopted.
Yeah, we're about to run out of time here, so I think at this point, with apologies to anybody whose question we didn't get to, although I think we got to most of them, at least generically, I'd like to thank our speakers, Meg and Eric and Matthew, for first of all for the work you've done, and secondly for the great conversation this afternoon. And now I'll turn it back over to Keith Martin of the Consortium of Universities for Global Health to close up the hour. Keith?
Thank you very much, Phil. That was a stellar webinar, and I think you've all done a great job of showcasing the importance of governance, how vital it is to have good governance and accountable governance to the people and to programs in order to improve health outcomes, and using the Global Fund and the not unique but effective management structures that have been created to ensure that limited funds are going to be used well for the public good. And I think you've also shown that it's not only for official development assistance that this can be used for, but lessons learned can be applied by governments within their own structures to utilize their funds, which vastly overshadow external funding, to meet the public needs of their citizens. Before we go, I just want to draw attention to at the consortium, we have created a capacity building platform that we are releasing this week, and it will enable low to middle income countries to list their training needs. And our hope is that that will enable institutions to find collaborators that can work with them to strengthen their own training capabilities, whether it's in government or in universities or beyond. So on behalf of the Consortium of Universities for Global Health, I'd like to really thank Dr. Meg Davis, Ambassador Dr. Eric Goosby, Dr. Matt Kavanaugh for being our speakers, and Dr. Phil Landrigan for being such a fantastic moderator. And for those of you who'd like to see this webinar, it'll be posted at cugh.org. And again, I just want to draw attention to the Annals of Global Health, where you'll see the articles that were written by today's speakers. in that edition of the Annals of Global Health. So from all of us here in Washington, D.C. At CUGH, I'd like to wish you all a wonderful day. And thank you again for tuning in to this webinar in a series of webinars from the Consortium of Universities for Global Health. Thanks, everybody.